Well, it figures that once I do a video on injury and inflammation that I actually get injured. And it's inevitable. I mean, when we try to initiate new lifestyle changes, whether you're an avid exerciser or you don't exercise, you're going to have a little bit of a flare-up of pain, whether you like it or not. The idea is that we try to decrease that flare-up or compress it so it's over fast. And that's why I think it's important to have a doctor that has training of musculoskeletal condition. I did a fellowship back in 1995. It's still valid even though it's way back when. But I've developed calming down, improving the speed of resolution, and I think I have a decent approach to reversing this inflammation fast. Even with my inflammation, which is more calf pain, I did a couple rounds of Swallow Cliff stairs, and I shot a video while I was doing that, and I knew something was happening by the time I hit the 12th and 13th round, so I had to cut it short. I probably could have done 20 rounds, but you have to be able to listen to your body, know what happens, and then anticipate that you're going to need some downtime. The last thing I want to do is, on your way to stardom, being disease-free and living till 100, I don't want you to suffer too much. It's a little bit tough, but that's where if you have pre-existing fibromyalgia, rheumatoid arthritis, chronic back pain, chronic headaches, any musculoskeletal disorder, it can potentially flare up when you start moving your body again. So give yourself some forgiveness, a little bit of leeway. If you are injured, count down and journal, because we have to, number one, know what the injury was caused by. Number two, we want to make sure that if it happens again, we can press that time frame of your healing time. So here I just put a couple of things. Pain is always equal to inflammation in most cases, whether it's a joint, a trigger point in a muscle, sometimes skin or tendon, especially if you have irritation to the wrist, irritation to the forearm, patellar tendonitis, Achilles tendonitis. There are several areas that we diagnose as being, okay, well, pay attention to that and we'll do no further harm. However, if you're on a roll, especially if you have begun to enjoy the endorphin and enkephalin response and get a really cool dopamine hit, it's important to maintain that even while you're injured. If I have calf pain from the step, it means I cross-train. The easy way out is if you have a lower extremity injury, then exercise the upper extremity, and vice versa. If you have a shoulder injury, then work out the lower extremity. If you have both upper and lower, then work your core. There's always something of a default that you can rely on to keep you invested. A lot of the exercise, the endorphin and enkephalins that you produce from exercising, comes from the brain because the brain knows what inherently is good for it, which is being healthy. If we take a break from that for a while, whether you're 50, 60, or 70, allow yourself some time to heal. Don't just be stagnant. If you have a back injury, then you can induce or try some yoga poses. It's not exactly like resistance, but it'll still give you some movement. Depending on who you use for a physical therapist or a trainer, or if you are my patient, I can tell you what to do until you're back to where you left off as far as exercise and trying to find your groove. Inflammation can be caused by tissue damage, by joint irritation, by sometimes tendon pain or tendon strain. All these things do cause a little bit of strain, and that results in remodeling or strengthening those muscle fibers, tendon fibers, and relaxing muscle spasm. It does take a while to get there, so you have to trust in the process. And if you constantly get injured, I would always want to see, okay, what are you doing with your building blocks for nutrition? Are you taking enough protein in? What are you doing as far as your sleep? I put down here that being under-rested is also a disease process, where it leads to a problem. Muscles, when they're used, cardio, when it's induced, will require you to heal and they get stronger. There's a signal that you give to your muscles, your cardiovascular system, that tells your body, let's get stronger for the next time. Play your cards right. You'll induce some kind of strain, rest up 24 to 48 hours, sometimes 72 hours if you're a beginner, and then hit it again. And if you keep on doing that, you give that muscle signal that it needs to start growing either more actin and myosin fibers or better blood vessels to the sarcolemma. It doesn't matter, whatever it is, we want to induce that little bit of strain so that it causes a homeostasis to occur that you fix and improve, so that the next time you induce that same stimulant, it's easier to tolerate, it's faster to resolve. If your amount of pain because of the recuperation is great, then you have to throttle that. Take note of what you did, take note of how long it takes to go away, and then you journal that. If you can figure that out, the next time it happens, you can curtail or shorten your amount of inflammation. Just because because you get injured doesn't mean you throw your hands up in the air and say, I give up. Learning from your injuries, and then hopefully you'll be a better athlete in the long run. Whether you're an Olympic athlete or you're a couch potato athlete, doesn't matter. The best way you can control your own disease is to modify your lifestyle, and I think exercise is the best way, in addition to nutrition and sleep and mindful practice. Hopefully this gives you a couple of ideas on what to get ready for. I'm going to swarm myself with my usual rescues. I use topical as far as helichrysum. I use CBD, whatever is available in the local dispensary. I also have topical from Colorado that I picked up a while ago, and then turmeric. You might also want to refrain from foods that usually cause or induce an inflammatory response, and there are a couple. I'll put them down below. Even though you're not allergic to certain foods, when you have an inflammatory signal that's popping up, and then you stack another signal and another signal, next few signals are poor sleep or high stress or underdosing on the protein and amino acids. All those variables should be kept to a minimum so that you can heal up as fast as possible. And if you're not sure what to do with those variables, you have to have a doctor on your team. And you can always access my care by clicking on herbal411.com or ask your doctor, because this is not meant to be medical advice, it's just meant to be educational, and hopefully your doctor can give you your personalized program. But if not, come see me and I can take care of you. I am going to offer a Zoom class for those of you who are not my warrior patients, and I might be able to answer, if there's not too many questions, your specific question on how to get past your speed bump of injury. Stay safe, try to keep on moving, try to keep on adding more exercise, work on nutrition, and hopefully we'll all get healthy together. Thanks for watching.